what I had always thought of and maligned as a mindless and stupid thing to do to an infant was actually something that would impact a man for the rest of his life.
Georganne, welcome to the Holistic OBGYN Podcast. I have a contemporary of yours, Brendan Murata. His episode will have aired by the time this one is released. Brendan has a background in the arts and filmmaking, and he's also a great writer. So he gave a really interesting perspective on the topic of circumcision. You and I are going to go even further with that. You've already spilled some incredible cans of beans in our pre-recording chat. So tell everybody, what's your background? I know you've got a long history as a social activist, but tell me your background. How did you come to circumcision?
Well, first, Nathan, let me thank you for having me on your program. I'm really thrilled. I've listened to some of your episodes, and I feel honored to be among your people you've interviewed and your great shows. So I am
My pleasure.
I am a 70-year-old woman, a mother of one son who is now 42, and I'm the daughter of social activists, civil rights activists back in the 60s, anti-war activists, and grew up with a very keenly attuned sense of social justice, or let's say social injustice. And I've been interested in related issues my whole life. I got interested in the issue of circumcision very early on. I had a brother who was born when I was almost 11, and he had a circumcision related complication, which nobody identified as such. I remember the trauma.
Yeah.
I don't remember understanding exactly what had caused it. And then as time went on, I have an undergraduate degree in anthropology, and then I went to graduate school at the School of Public Health at Columbia University. And that was a time in the 70s when people were talking about female genital mutilation.
Sure.
And I remember, some of my feminist activist friends who were teaching in the School of Public Health, teaching in social sciences, being appropriately horrified about girls getting their genitals cut. And I made a casual comment. I said, well, we do that to boys. And if you're ever in any doubt about striking a nerve, measure the impact, measure the passion with which you get shut down. And people,
you're hitting a pain point.
Yeah,
you pluck the right string.
It was unbelievable. I mean, I got lectured by people who told me how smart they were and how completely stupid I was because I would ever equate the two. And I just said, look, you're cutting the genitals you're cutting the healthy genitals of a child who can't consent. And there's nothing wrong with the child. It's the same. So that argument, continues to be played out. I don't go a week without somebody telling me that female genital cutting is worse than male genital cutting. And you can go into a lot of reasons why, there are nuances. Female genital cutting is not one simple simple procedure. It's, it can vary.
Your career path seems to be very similar to mine, bringing up things around natural birth, undisturbed birth, really leaning into somebody like Michelle O'Donnell's work, who was not an OBGYN, but a general surgeon, and the conjecturing around the curiosities around, could we do this better? That really is it's an inflammatory thing to do in the academic setting, especially in the 70s, I imagine.
Right. So how dare you think you know more? Right.
What's up, everybody? It's Nathan, the host of your favorite podcast, the only OBGYN podcast that matters, the Holistic OBGYN Podcast. So here's 3 things that you can do right now. Number 1, if you like these episodes, if you like the show, share it with people you love. They're probably going to like it too. The second is to support our sponsors. I've aligned myself with brands that make the best, highest quality products out there, all pertaining to fertility, pregnancy, postpartum, parenting, you name it. Support them. Let them know that you're paying attention. And then third is that I want you to take a moment and click like. Let the Googleverse and the interwebs know that you're listening, that you're paying attention to the Holistic OBGYN Podcast. Believe it or not, this really matters. So it's so important that I'm just going to take a brief pause right now. I'm going to let you go and click that like button. So just don't mind me. I'm just going to wait. All right. You've done it? Perfect. Thank you so much. I think I've said enough. Let's get back to my conversation.
Michelle O'Donnell has been a supporter of the we call it the intactivist movement. It's a word that comes from intact, as in the whole intact body, and
Yeah.
activist.
Yeah.
But we could say the anti-circumcision movement.
Yeah.
So he's been very eloquent in that space.
Yeah.
So it's true that there was a context for this in taking back. Well, women did it very well, taking back their bodies, right? That was our bodies ourselves. But unfortunately, despite opportunities to do differently, they really abdicated on the issue of male circumcision. And here they were, the literal custodians of helpless baby boys, and they said, circumcision was, they're not going to deal with that. It's not a women's issue. Well, of course it's a women's issue. That's like saying, having your child paddled in school is not a mother's issue. It's everybody's issue.
It's everybody.
Right?
It's society's issue. This is a question for all of us. Yeah.
And particularly, so I got interested in this, deeper and deeper, and I would have this conversation for years before I actually did anything about it. And in 1998, my son was 18 years old. And we were on a road trip, and kind of out of the blue, a conversation had happened the day before at a family gathering. And when we were heading back to New York, he thanked me. He said, "I never thanked you and Dad for not having me circumcised. And I want to thank you." And it was, he was driving, or I would have probably run off the road. It hit me so powerfully that what I had always thought of and maligned as a mindless and stupid thing to do to an infant was actually something that would impact a man for the rest of his life. And I had accumulated knowledge about that over, my adult life, but I had never really put it together. And when he said that, I became an activist, like that minute. And then shortly after that, I just happened, coincidentally, or maybe the gods were on my side, I don't know. I happened to go to law school mid-career. I had been running a Medicaid managed care plan. I'd helped to start it up and run it in New York State. It was a nonprofit, and we served low-income people. And I just needed to do something different, but I love my job. So I thought, well, let me just go to law school and see what I can learn there. And that became a voyage, really, in my work against male child genital cutting, which is the most neutral term and revealing term you can use to describe what we call circumcision. And I wrote some papers about it. And then I met people who were working in that movement that I had been unaware of until I started actually researching the topic kind of academically. And I met Marilyn Milos, who was founder of the movement. She's an RN. She founded an organization called No Circ, has a longer name. Eventually became something called Genital Autonomy, and she's now part of Intact America, which is the org I ended up founding in 2008 with the help of, I'd say, a couple dozen people who'd been doing this work for a couple of decades.
Yeah.
And with the funding from a private donor who, a guy who had one son, one daughter. He was a businessman from Texas. And when he and his wife were asked when she was pregnant with their son, well, you're going to circumcise him, right? If it's a boy, you're going to circumcise him, right? And he had never thought about it. And he just said, well, I don't know. Why would we do that? And when she said, the OB answered him and said, well, because everybody does it. This guy's, nonconforming. It was like, that was enough for him.
Yeah.
So I ended up meeting him through Maryland. He ended up giving us seed money to start Intact America. And that was in 2008. So for the last nearly 15 years, I've been running as the founding executive director. I've been running this organization called Intact America. And and using everything I've learned my entire life, which is such a privilege, right?
Yeah. Yeah.
If you reach a certain age, to be able to look back and see the trajectory. And I sense that from the work you do, that, and from what I've read about you, that you also have incorporated every experience in every place and probably every patient and colleague into your philosophy and your body of work. And it's really, I feel incredibly lucky to have had the exposure that I've had over the years to these issues.
Sure. Well, as an OBGYN, and in the previous recording I did with Brendan, I talked about what the procedure looks like, because as an OBGYN, as a resident, it was a requirement. You do so many circumcisions every, Friday or whatever. During these particular 12 weeks, you're in there. You maybe do 2 to 3 in the morning, and then you go about your day. You go to surgery, and you don't put much thought into it. And as a resident, because you're sleep deprived, you're kind of held to the fire, so to speak, as to what you need to do to be, granted permission to call yourself an OBGYN. Yeah.
Right,
so
right.
A lot of OBGYNs don't think about it. And through cognitive dissonance, not only do they do circumcision, but they do all these other interventions in childbirth that probably deep down they realize is not necessary to stick your hand in someone's vagina in the middle of the night to see what their cervical dilation is.
Right.
So that alone, not to mention all the C-sections and unnecessary surgeries and the synthetic hormone disruptors that we give, or synthetic endocrine disruptors like birth control and all of that. I started asking all those questions early on, but circumcision was one of those fires. It was like, with all these fires, that's a fire that's going to have to sit on the back burner. And now that I'm a parent of 2 little girls, my wife and I have had some pretty extensive conversations around whether or not we would do it. And I kind of came to the same conclusion. It was like, I guess we'll do it because I'm circumcised. And of course, now, fast forward, we have 2 children, and there's no way in hell I would have done that to my son. But it's because I feel like I've been grappling with these other fires. I have those sort of down to embers, so to speak, in my spheres. People that come to me are those who oftentimes maybe even want a free birth. They don't even want to have a hospital birth, let alone a home birth attended by a midwife. So there's this pendulum that's swinging, and I think that the same is happening for circumcision. But given my experiences in OBGYN, I can reflect on what some of these other OBGYNs were saying. And before we started recording, you said that in your advocacy work, several OBGYNs have given you some pretty harsh criticism and also some maybe close allyship. Can you talk a little bit about those interactions you've had?
Right. Well, I think you really hit the nail on the head when you said that your training was, I'm going to use a word you didn't use, desensitizing, right? That
dehumanizing is actually the word I would use. I would take it further.
Right. So it's something that people, you do things that you don't do that much thinking about unless you maybe have some jarring experience. But people who have become opponents of what we do to newborn babies, which is often in the past, till recently, with no anesthesia and still with absolutely inadequate pain relief, take a little tiny baby and apply a clamp to the most sensitive part of his body. And anyone who tells you baby doesn't feel pain is just ridiculously in denial. Every mother knows that their infant can feel pain, and that it's not licensed to stick a needle or a knife into somebody because they might not feel it.
Right.
So this what we do. We tie down a newborn baby who should be in his mother's arms or be swaddled and taken. We strip that baby naked and put that baby on a hard, cold plastic mold, essentially, that immobilizes him with restraining straps like you would use for to immobilize a criminal, and then proceed to clamp and slice off the most sensitive part of his body. And then we tell ourselves that it really doesn't matter. It's really insignificant. Foreskin is insignificant, which I always say, if it's so insignificant, why the obsession with cutting it off? And then we deny that this has any consequences for not just the child, you know, not just the mother who just lost those bonding moments with her child, but for the person who actually has to repress the knowledge that they are slicing off and permanently removing a healthy body part from a newborn child who cannot consent, who is vocally
Right.
not consenting, vocally protesting, right? So when you think this through, and you know, I have to tone it down in my daily life. Um, this is something we do to a person who has just come into the world that has consequences for everybody in that child's constellation, has consequences for the child and everybody, including the person who severed that child's foreskin and threw it in the trash or
Yeah.
gave it to some, you know, medical biotech company, right?
Yeah. Yeah.
So I just think that it's, I don't even remember what question you asked me, Nathan. That's how I view this process. And I think the implications of it in our culture cannot be overstated.
That's right.
I
So
also don't believe it's just a men's issue. So you mentioned, you know, you're circumcised, so you thought you would circumcise your son. Well, you know, people say, well, boy should look like his father. Well, what do you do with your child who has a different color eyes? What do you do with a child who doesn't have your curly hair or, you know, your wife's lips
your
or
metabolism, the shape of your
yeah,
body.
I
Yeah.
mean, it's the most absurd, thing
Yeah.
you could possibly say. There are 100 other body parts that are more in evidence, and no baby's genitals look like his or her mother's or father's genitals. For one thing,
Yeah.
there's no hair, the size is different. I mean, it's an absurd statement. And
I agree.
so I guess I just repeat that I don't think that when I see somebody like you who identify yourself as a holistic practitioner, I think if we take that approach, there's simply no argument that cutting a body part, a healthy, normal body part off of a child, um, is an okay thing to do. It's simply
Yeah.
not. There
Yeah.
should be no doubt.
Yeah. So my other specialty is end of life care,
Mhm.
and Dame Cecily Saunders of the UK, she
Right,
was the foundress of the modern hospice movement.
right,
She used a term total pain, which is really what gave way to how we communicate with, let's say, somebody who's faced with their mortality way before they wanted to. Let's say they get diagnosed with prostate cancer or something at age 60,
right,
lung cancer, heart failure, whatever. They are now looking down that tunnel and realizing the end of the tunnel is coming way sooner. So that in and of itself causes pain. And she used a term called total pain. There's psychological pain, there's
uh-huh,
emotional pain, there's even existential pain related to the question of what's going to happen to me after I pass through this portal
right,
at the
right,
end of my life on Earth. And I think even as we consider how maternity care and how I'm trying to change maternity care in the United States, we have to consider the entire experience. In other words, just because you didn't feel pain during your C-section, does that make it any less traumatic to be
right,
strapped down, to have people operating on you through the lens of anesthesia, meaning not that you're not necessarily feeling pain, but you can't even feel your body.
right.
It's a dissociative practice.
Well, some of that has come up in the movement against being examined while under anesthesia
That's right.
in academic medical centers where any number of medical students or residents can put their hands inside, and this is particularly women protesting this, put their hands inside your body, inside your vagina, and feel your internal organs. And women weren't even told that they were being subjected to these exams,
Yeah.
and they don't remember it. But it's a violation
Their
nonetheless.
body
The
might
fact
remember it.
their
Their
body
body
might
might
remember it.
remember
I
it.
should
Yeah.
right, correct.
Yeah.
Consciously, they might not have a recollection, but when they find out afterwards, I mean, it's a revolting, life-changing revelation,
Yeah.
right?
Yeah.
And there's a history of abuse in modern medicine, abuse like that. And usually the people getting abused are the powerless. It's people, it's low-income people in urban hospitals that are used as teaching hospitals. It's babies, right? Baby boys in this case. So there's a backlash against these things, but I think circumcision is a little late to the game, and it's because there's so much denial about about the absolute fact that it's not medically necessary, that it's an assembly line medical practice, part of assembly line American medicine. And we should say right now that this is something that no other no other country, period, does as a routine medical procedure the way the US does. The other English-speaking countries did it for a while, and they gave it up when they realized that it was medically unnecessary and costly to the system. And then South Korea learned it from the US and the Philippines to some extent, because they were taught by US doctors. So South Korea has a fairly high medical circumcision rate. But in the rest of the world, circumcision is, among Muslims and among Jews, considered a ritual practice or a cultural mandate. But throughout Europe, Latin America, there's no routine circumcision of baby boys.
Right.
And they're all, they're fine, right? I mean, that's if you listen to
they're not all dying of penile cancer and HIV and STDs
urinary
as we were taught.
infections. Right, exactly.
So ridiculous.
They should be dropping like flies, in France from urinary tract infections. And we actually have our health status is way below those countries.
Yeah.
So circumcision, there's no question that circumcision, even if you don't want to say that it harms health, which of course I believe it does. I think we have lots of evidence that it does. Certainly doesn't help anybody. It absolutely doesn't help. Doesn't make our boys and our men healthier.
Yeah. So the previous question I'd asked that, I'm glad that we captured that piece of this conversation. But the question I'd asked, which I think is very relevant, is as you've been advocating for this, you've received quite a bit of kudos from people like me, and you've received a lot of criticism from people like me, especially I'm talking about OBGYNs here. Can you talk about a little bit about some of those interactions, maybe? Because I think it does reflect just how normalized this practice has become, that this has become so confronting to your typical, very smart, highly educated, blah, 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 OBGYN. Why are you receiving such pushback? I mean, what is the deal here?
Well, I think that when you do something that is clearly unjustified, the only way you can keep doing it is by denying that it's harmful. So a lot of the pushback I get from physicians is basically saying it used to be how circumcision was a good thing. People don't even bother saying that anymore. They say the parents demand it. The parents want it. So all of a sudden you're like the cereal companies that say, kids like sweetened cereals, they like Captain Crunch, or so we're going to give it to them as healthy food.
Fortify with folate and all this other crap, synthetic vitamins and nutrients. Yeah.
So I have to tell you, I respectfully will disagree with somebody who tells me these things, but I don't respect their reasoning because it's vacuous. It's just wrong. And it's very, it's unserious. You can't dignify some of the justifications. I had an OB write to me recently saying that I unfairly maligned OBGYNs who do so much good in the world. And believe me, she said, she actually used this language. She said, OBGYNs I know hate doing circumcisions. They're a terrible pain in the ass for us. And they just disrupt our day. And I can assure you we don't do it to make money. And so I read this, it's like, well, just stop. right? Just stop. Just say,
Just don't cut off the
just
baby's
don't
penis
do it. Right,
skin.
right. I mean,
Yeah,
what
it's
is
pretty
there?
easy.
How do I answer? So, I say, oh, now I understand. You hate doing it. I'm really, I'm
You
sorry.
poor doctor. I wish there was a way to stop it.
Right. I'm sorry you have to do. I mean, it's the easiest thing in the world, but it should be the easiest thing in the world to stop. But it is so embedded in our so-called healthcare system, in our medical system, and our assembly line medicine that selling circumcision starts before a mom is even pregnant, right?
Right.
I mean, the culture, so you read some baby magazine, the most important decision you're going to make when you find out you're pregnant is if you're going to circumcise your son. Now, if you talk to somebody from a non-circumcising country, nobody says, you're going to have to make this very important decision. It just doesn't even come up.
That's a good point.
Right. So women are pre-programmed, family, and then throughout the pregnancy, at the ultrasound, now there's a routine ultrasound at, what is it, usually 15, 16 weeks or something?
It's that level 2 where you identify the sex is around 18 to 20 weeks.
Okay.
Generally.
And I've talked to, now I don't work in a hospital. I've talked to several people who've said that it's part of the record that if it's a male child, the mother is asked if she plans to circumcise. Now, that baby's still, that's a fetus, and we're already talking about when that fetus comes out of the mother's womb, what part of the body are you going to cut off? And don't tell me, I suppose you don't want to cut the umbilical cord either. Well, that's just a ridiculous thing to say. The umbilical cord has to be cut for the child to become an independent functioning human being. Nobody walks around with the placenta dragging, behind their feet, for 70 years. But the foreskin is yours. It's yours. Doesn't belong to anybody else to cut off. And here the mother is pre-programmed. Then she gets to the hospital. It's often asked as part of the intake process. And then she's very often asked in the delivery room. And it's not like, have you thought about whether you're going to circumcise your baby? It's what I hear is, you're going to circumcise him, right? The doctor's going to be by in the morning, and the pressure. So Intact America, which is the organization that I run, we haven't said that yet, but I'm the executive director of Intact America, which is a not-for-profit organization that wants to change the way America thinks about circumcision. And Intact America has been doing surveys recently, and we found that the average, a nationwide survey, we go through Qualtrics, the average number of times women are asked if they want to circumcise their baby is 8 times. Many are asked as many as 12 times.
That's how many times they're asked before the baby is born?
No, up to the time
up
of
until
the birth.
8
and
times.
So people say, well, we're just asking. We're not trying to sell it. Well, that's like in McDonald's, I have nothing against McDonald's.
I have everything against McDonald's. Fuck McDonald's.
Yeah, okay, right. Would you like fries with that? It's like, are you sure you don't want fries? You want to supersize that up? I mean, this is called selling.
Are you sure?
Yeah, are you sure?
What if we sweeten the deal? We'll give you a BOGO if you double your fry size or whatever.
Right.
Size
so that's how circumcision is sold.
Yeah.
It is unethical. You're not allowed to solicit. The AMA ethical guidelines say you're not allowed to solicit unnecessary medical practices, not to mention that parental consent for a medically unnecessary, permanently altering procedure is not adequate. You have to wait until that person becomes of an age to give the person who's going to live with the consequences, to give them enough information that they can make informed consent. And no infant can do that. So we have invented a special category for parental proxy consent in allowing a parent to sign off on a child's circumcision. That is not a therapeutic procedure any more than a tattoo is. A tattoo is criminalized. Anyone who would do a tattoo, and the parent can be also prosecuted for allowing a tattoo on any child under the age of 18.
Wow, I didn't know that.
Yeah, you're not allowed to let your neighbor come in and feel up your daughter, just because the mother says, "Oh, yeah, it's okay. Sure, no problem." This is an assault on the child that no parent has the right in medicine or law to consent to, except we've carved out this exception
Mm,
for this benign sounding procedure called circumcision.
yeah.
Now, nobody who's really paying attention can justify that surgery as being benign. You're slicing off the most sensitive part of your child's body.
Yeah.
Um, and so this is something that's sold all along. The impact is minimized. People are told, we've surveyed people who were told that it was medically necessary. We've surveyed people who were told that it's required by the hospital.
Mm.
We've heard from people who said that they were asked to sign a disclaimer. They were that they there was two sides of the consent sheet, and you had to acknowledge that you refused a circumcision. I mean, every variation, and I can't tell you how shocked I was when all of these things started, coming to me, because my own experience when my son was born, and I thank everybody in my orbit for this, including a European obstetrician who was, in retrospect, not was from a country that did not do circumcisions, and nobody pressured me. I didn't have to fight off anybody. I mean, I think I would have been able to fight them off,
Sure.
but nobody
I think you
pressured
would have
me.
been okay.
Yeah, my son had pediatricians growing up who never remarked on the fact that he was intact. They were just treated him like he was normal, which of course he was.
Hmm.
So, but I've heard far more, probably, 90%, 95% of the people I've spoken to over the last 30 years about this were subjected to some kind of pressure
Which I
while
would
in
say
the
is
hospital.
coercion in a lot of ways,
It's absolutely coercion. Yep. And they said, and to say, "Oh, we just asked. We didn't tell them that."
Right.
Again, you want fries with that, right?
Georganne, you know, a lot of my colleagues, and I think the parents that are being counseled by them, in some ways, I guess I could say, oh, it's not your fault. It's normalized by our culture. But just like with childbirth, if something's confronting to you about, let's say, a birth intervention, that's obviously a great body of a great deal of my work is really
Right.
confronting this notion that we need to intervene at every step of the way in childbirth.
Mm-hmm.
Well, the line I always that I've come to that I use on a daily basis is the evidence of, or the burden of evidence lies to those who wish to deviate from nature. And we don't have a lot of evidence here about this circumcision thing. In fact, these little quips that we provide in our 15 seconds of counseling, and you as a JD, and you've talked a lot about autonomy and justice, in order for us to honor the principles of bioethics, we have to provide information for a person to make an informed decision. Well, the information we're providing is crap at very best, with regards to a decreased lifetime risk of, UTIs, penile cancer, HIV. Because we don't really, we can go into the studies if people would prefer. I did do this a little bit with Brendan, but I'm curious as to how confronting is it to you in your activist work, your advocacy work, when we don't even have evidence to support the practice? And when these doctors are pushing back, what evidence are they really hoping that we see that suggests or demonstrates without a shadow of a doubt that this is a good thing to be doing, without even considering a variety of other factors, that we mentioned before, the mental, emotional, and perhaps even spiritual aspects of strapping a little boy down, teaching him that, hey, as long as I'm bigger and stronger than you, I can do whatever I want to your body. Let's talk about the evidence.
Yeah, it's interesting because in the years I've been doing this work, I have seen these supposed evidence-based arguments kind of fall away. And in the last perhaps 5 years, and some of us, my colleagues and I have talked about this, people aren't even bothering telling you that it's medically beneficial. The argument has gone almost entirely to the cultural argument, like the look like the father, or it's our culture, or the mythical locker room where your son's going to be made fun of. I don't think most doctors believe that cutting off a baby's foreskin has any medical benefits at all. They're not seeing intact children dying from urinary tract infections. They're not seeing, they're seeing complications, right? I mean, the American Academy of Pediatrics made a statement a few years ago that the rate of complications is particularly low, and they are ignoring case reports of deaths because those are just case reports, but that they really can't quantify the risks because they've never been systematically studied. Well, how can you recommend a procedure when the risks and complications have never been systematically studied?
That's exactly right.
And I'm not making this up. I mean, I'm not paraphrasing. That's a statement in a 2012 report from the American Academy of Pediatrics that the risks have never been systematically studied. So you have live epidemiology, you have real on the ground epidemiological evidence that circumcision does not improve health. You have the entire European continent, which does not conduct routine circumcisions. You have better health status in those populations. You don't have men and boys, dying at higher rates of those countries have lower rates of HIV than the US and other sexually transmitted diseases because they do a better job at sex education. There's nothing about urinary tract infections. It's not a reportable disease, but they certainly it's not a health problem in these countries. And penile cancer, men have a 1 in 100,000 lifetime chance of developing penile cancer, where women have a 1 in 8 chance, American women, of developing breast cancer. And that could be completely wiped out, the latter, by removing the breast buds and not allowing girls' breasts to develop. And nobody's advocating for that.
Great point.
So really, most of what I hear is just an argument for perpetuating the status quo. My colleague, Dan Bollinger, who's the vice chair of the board of Intact America, again, my organization, intactamerica.org, said, keep your son intact and your grandson will look like his dad. In other words, break the cycle, right? I'm 70, and my parents' generation, virtually none of the men, most of our fathers at this age, have passed on. My stepfather is still alive, the man who raised me. And they're not, people born before the 1940s, men born before the 1940s are generally not cut. Certainly mid-30s was kind of when it started to become more popular. And so our entire history, world history, except if we're Muslim or Jewish, is intact men. So the status quo is what's driving this. And then the medicalization of everything we do, which is what you so eloquently bring to light in your work, the over medicalization and the assembly line sort of putting people into a sausage making machine, where they're pushed and prodded out the other end.
Forgive the pun.
Yeah, right. It's absolutely mindless. It's absolutely disdainful of the child's rights. If you're going to cut off someone's body part, you better be able to show that in the absence of cutting off that body part, that person is going to be sick, right? That's a pretty dramatic intervention to cut off a healthy part of somebody's body. If we started right now promoting, if I started saying, you know what, the little toe is going to go by the wayside one day. Somebody said, in 400,000 years, people won't have little toes anymore. So why don't we just cut off the little toe now? You would have to prove that cutting off the little toe has some kind of medical benefit, right? And no one, and you would have to say that intervention is fairly extreme. So the consequences of having the middle toe have to be even more extremely negative. And that's never been done with the foreskin.
Right.
Right? You're strapping down a child, performing a painful procedure that permanently removes functional tissue. We haven't even talked about the function of the foreskin. Maybe we could spend a second on that.
Yeah, we'll do that next.
And you need to be able to show that that is a therapeutic procedure that improves the life or health of the child so dramatically that you can forego rules about informed consent. You can forego the fact that pain management is inadequate. You can dismiss the fact of complications. You can say the complications are far less drastic than making that child live with his intact foreskin.
Yeah.
What's a little bleeding? What's 100 deaths a year? What's the risk of losing the head of the penis, the glans penis that can get severed? Well, I once asked a pediatric urologist, well, what do you say, who was kind of minimizing the impact of circumcision? And I said, what do you say to parents who have a child that was terribly maimed in a circumcision procedure? And he said, bring him to me and I'll fix it. And I said, well, what do you say
Thanks, Doc.
to parents what do you say to the child who you can't fix? And he just said, well, there aren't that many of those. Yeah, but what if it's you or your baby?
Yeah. So, sort of summarizing everything that you just said, which is really the crux of this. It's really what I was getting into with the sort of informed consent piece, or the burden of evidence lies to those who wish to deviate from nature, is that not only have we over medicalized everything from childbirth to even death and dying, but circumcision certainly falls in here. We've not just over medicalized it, we've over pathologized these things.
Right. Yes.
We've
The
created.
foreskin is a pathological thing. Yes.
Exactly. We've provided the illusion that there's a disease here. And I don't know if it's something I heard through intact.org, intactamerica.org's work, through your advocacy, or if it was somewhere else, but circumcision seems to be a cure searching for a disease. So we need to really come up with a disease.
Right.
And the same goes for childbirth. You don't want your baby to die, do you? Well, how do you answer that question?
Right.
No, I don't want my baby to die. Well, then you better do what we're suggesting, which is to have an unnecessary C-section. Or you better let me do a vaginal exam, which is neither fully consented because it was consented under duress, or it's just me putting your hand somewhere it doesn't belong without really being able to glean all that much information. Anyways, I think circumcision falls into this over pathologized, or foreskin, we can say, has been pathologized in our culture in order to provide some justification for doing this surgery. It's not a procedure. This is a surgery. That's the other thing is, let's call it what it is. This is not a clipping of your toenails. This is a surgery requiring sterile instruments, requiring sharp needles to inject nerve blocking agents into the penile nerve so that you don't get any sensation there. So I think this is very, very helpful. And since we're talking about sensation, and since you brought it up, why don't we go into that? What is the benefit of foreskin? I mean, it makes great lotion. Why not just keep doing that? Because boys seem to do great without their foreskin.
It's so valuable as a cosmetic because of its incredible properties, really unparalleled by any other part of the body.
That should tell us enough right there, right?
It's so worthless that we're going to cut it off and deprive the owner of it, right? So crazy, yeah. The foreskin is a double layered extension of the tissue, the skin on the penis, but it's a very different type of skin because it has an outer layer and an inner mucosal layer, and there's a ridge, in between those two things. So when during intromission or during masturbation or intercourse, and the foreskin is retracted, the inner part of the foreskin, which is extremely sensitive, is exposed to the either the partner's vagina, if the partner's a woman, or to the friction of of self-pleasuring masturbation, whatever turns the owner of the foreskin on. And the head of the penis, which is meant to be an internal organ, right? It's like the inside of your nose. It's like the inside of your mouth. Imagine if you remove someone's lips and cut the frenulum that keeps the lips in place, and all of a sudden their lower part of their mouth just hung open and exposed the inside of the mouth. That would dry out. The tongue would dry out. Eventually, you wouldn't be able to taste your food. You wouldn't be able to even digest your food appropriately because your saliva would be dried up. So removing the foreskin from a male permanently exposes the glans penis, which is the head of the penis, to the elements, to the air, to underwear, to abrasions, to the bedclothes. And over time, the head of the penis becomes desensitized. So you've desensitized the penis in two different ways. You've desensitized it by exposing the glands to the elements and turn that internal organ into an external organ. Probably a better analogy, more understandable, because no one can even imagine living without lips and a tongue, would be removing the fingernail, and then like completely removing it. And then, you would have this exquisitely painful nail bed, but over time it would callus over and you would lose a sensation in it. And that's what happens to the head of the penis of a circumcised man.
So I really am missing out.
It happens gradually. Unfortunately, when people say to me, am I missing something? I say, yeah, you are.
Probably.
You are literally missing something. So again, using the fingernail analogy, you're missing your fingernail. If you have your fingernail ripped out, you're missing it. Does it mean you can't pick things up off the floor? Does it mean you can't have a nice dinner or a nice life? Does it mean this is something that's necessarily going to, obsess you for 24 hours a day? No, not necessarily, but you're missing your fingernail. And that has consequences for your finger.
Yeah.
Missing your foreskin has consequences for your penis and also for your psyche. We don't understand that well enough. But I have heard from, probably at this point, thousands of men, and about the consequences to them of having this done to them as a baby and living without their foreskin. And what I hear at the most basic and benign bit of information is, I can't feel what I used to feel. I don't have the kind of sensation in my penis that I used to have.
Meaning, wait, can I clarify that?
Sensation.
So this is a person, let's say, sorry for cutting you off. I just got excited here. What you're saying is, what people often say is, well, you're not going to know the difference anyways because it was cut off day one of life, your foreskin. But if I'm hearing you correctly, what you're saying is, you start having sex, whatever, age 20, and then by age 40, it's actually less pleasurable because of the processes,
Correct.
The callousing and whatnot. No kidding. Interesting.
And depending on the extent of the tissue that was removed and the technique of the practitioner, keep in mind that little tiny flap of skin that we keep, denigrating, becomes a really big organ in an adult.
Yeah.
Right.
Yeah.
Right. So that little tiny flap of skin that was so insignificant, depending on the technique and the precision in which it's cut off, some men and boys never have proper sexual sensation. Others do, and lust and love goes a long way, right? But over time, there really appears to be no evidence, that how can I say it? It appears to be pretty much ubiquitous that sensitivity and sensation decline over time in the circumcised penis. And Intact America, and as most of the intactivist movement, started out really focusing on babies. And that's still a huge focus, of course, because we want to protect babies. But our constituents, if you will, Intact America, and 90 something percent of our donors are middle-aged and older men who are feeling the consequences of having had that body part removed.
Mm.
And it's just irrefutable. I have heard, like I said, hundreds at least of stories. My inbox is full of them, from men who lament their inability to feel what they should be feeling during the sex act or during masturbation.
Yeah, I have a lot of, it doesn't really serve me, but I have a lot of guilt about having done so many of these procedures as a resident. And, while I was actively trying to fly under the radar, really, with regards to not doing the routine cervical exams and pushing back against surgeries and C-sections and birth control, like asking all those questions, similar to you in your career, earlier in your career, having just pushed the wrong buttons at the wrong time, and people just wanting to flunk you out. And I was still getting the right answers on the test, so I couldn't really flunk out. But they were not happy with me. They didn't want to work with me. These are my attendings, the people that are getting given me the thumbs up or thumbs down, like you're in the Colosseum, gladiatorial days.
Right.
Of all the fires, as I mentioned, circumcision was not one that I didn't feel good about it, but it was one that was like, man, I'm not going to push back on this.
Didn't take a stand on that one, right?
Yeah, and I feel I lament how many little boys did I do that to in order to just make it through my day, and I feel somewhat resentful for having been the realities of this procedure having been obscured, and I was a very open-minded, open-hearted, compassionate guy, which was part of the reason that I didn't fit well in the conventional medical system. And people know my story of having been fired a year ago because I took my mask down while caring for a 95-year-old dying man. Yes, COVID. Yes, masks. Yes, vaccines. Okay, fine. But this person is an individual, a single person who deserves a lot of dignity and compassion right now. And he didn't want me to wear a mask, so I didn't, and I got fired the next day. So throughout my entire life, I've struggled with playing by the rules when the rules don't make sense to me. And I still, despite all of my advocacy work now, I still feel bad. Like those individual boys, those individual families are perhaps coping with a great deal of pain, and we're talking total pain here, as a result of this prescribed way of managing little boys at day one of life, when they weren't given truly informed consent
of their body parts.
That's right. That's right. Yeah.
Well, your voice is extremely powerful here. Just as, in the early days of the movement, and in my work, we used a lot of kind of intellectual arguments, it's human rights violation, it's not medically necessary. Those things don't fire anybody up. But a man standing there and saying, I can't feel my penis anymore. I'm 42 years old and I can't feel my penis anymore. Wow. Who's going to argue with that, right? You can't argue with that. And so a doctor who will say, I cut little baby boys and I did it because that was part of my training, but right now I have trouble sleeping or thinking about it or whatever. Nobody can argue with that, And you as a doctor, you as my younger colleague need to hear me when I say that I regret having cut these boys. And if we could, everybody in this system is involved in perpetuating the promiscuous and unnecessary removal of baby boys' foreskins. So the hospitals, the doctors, the parents are victims in some way, but they will acquiesce. The sonographer who asks the question when it's a male fetus, the admission clerk who says, you want them circumcised, right? We're all part of that system. And somebody's got to like raise their hand and say, stop this. We got to stop this. And you're in a where each of us has our own unique perspective, right? I have my story about my son thanking me for keeping him intact.
Yeah.
I argued about circumcision from an intellectual standpoint for years. I have people, since I tell that story about my son thanking me, I've had the most improbable people demographically burst into tears when I said that. One of my attorneys that I used when I ran this big HMO burst into tears when I told that story. I don't even know what made that, but that story still brings me to tears, but I've seen it bring grown men to their knees, right? So your voice is extremely powerful on other issues also. And, one of the things that happens with this issue is it's like, oh my God, I'm already vilified. Everybody thinks I'm a kook. If I start talking about circumcision, they're really going to hate me. But, and I've been through that. And it's like, well, sorry, people say, well, why are you so obsessed with circumcision? I said, well, I'm not the one that's cutting off part of baby boys' penises.
Yeah.
I'm obsessed with the wrong that's being done. But why are you so obsessed with justifying the removal of a healthy body part?
Yeah.
I don't feel bad for talking about it. You're the one that's, it's like that joke about, I'm not the one who's lost, somebody's driving through the country and asks a local, can you tell me how to get to such and such? I said, I don't know. And the tourist says, what do you mean you don't know? How long have you lived here? I've lived here all my life. Well, how could you not know? And then the guy looks at the tourist. He says, I'm not the one that's lost. And that's really, how I feel about this issue. I'm a voice for just letting normal be normal and letting people have the bodies they were born with. Not undermining a mother's instinct and not really, feel, well, I don't want to tell the father, because he's circumcised, so I will let him say it's okay to circumcise his kid. Don't insult a man like that.
Yeah.
This guy can understand that you're not disrespecting him. You can say, look, I understand, you're ambivalent about this, but you might have liked to have the choice yourself. Just let your son alone. He can always decide later. Everybody can be respected here. And this procedure respects nobody. There are lots of parents that are choosing to keep their children intact. That was ultimately the goal of the movement, of the intactivist movement, to protect baby boys. Unfortunately, because we live in a circumcising culture and doctors are unfamiliar with, if not uncomfortable, about the male foreskin, there's a new risk out there, which is forcible foreskin retraction. So parents who fought really hard to keep their kids intact, they'll take, mom will take the baby to the emergency room for vomiting or diarrhea, and the doctor will spot that intact penis and grab it and forcibly tear back the foreskin.
Gosh.
Called forcible foreskin retraction, and say that if the mother doesn't do that and regularly retract her son's foreskin, he's going to have to be circumcised later because he's going to get infections. Nothing could be more false. The baby is born with a foreskin that is attached to the head of the penis. It separates over time, sometimes not till the child is a teenager, that intact children are subjected to.
Wow.
So I have to say that intactamerica.org, we talk about forcible foreskin retraction. We also have another site, kind of an entry-level site for people who can't take our level of revelation, called the circumcisiondebate.org. We have pages on Facebook and also Instagram. We're on Twitter, at least for now.
We'll see how long that takes.
Right. So lots and lots and lots of information. If you have anybody tell you circumcision is medically beneficial, just tell them they're full of it. Move on.
I think that's a great way to wrap up the conversation, Georganne. I will also plug Brendan Murata's work, the Intactivist Guidebook. a handbook.
his film American Circumcision.
American Circumcision, excellent.
Right.
There was another film as well. Was it called The Elephant in the Room?
Yeah,
Or
that's a more of an academic presentation, right? And then there's a film made by some two midwives from Minnesota called The Circumcision Movie, which is also really nice. You can
great.
buy it online, I think.
Okay, great. There's a couple other titles that you mentioned. Can you recall the names of those books?
Sure. Yes, we were talking before the show, and for people who want to know kind of a popular history of circumcision, if that's not a contradiction in terms, there's a journalist named David Gallaher, Gollaher, and it's called Circumcision, the history of a history of the world's most controversial surgery. And it is a very informative, very readable history of circumcision. And because it's 20 years old, it does not go into the way the intactivist movement has changed in the last 20 years, but it's still a wonderful history. There's also a urologist named Adrienne Carmack, Carmack. She has a book, which would be right, you'd love it, Nathan, called Reclaiming My Birthright. She talks about when she was pregnant, deciding to have her baby her way. And she also has a book called The Good Mommy's Guide to Her Little Boy's Penis. And she talks about, she's obviously opposed to circumcising healthy children. So Adrienne Carmack, Carmack, and those are available, I'm pretty sure, on Amazon, both of those books. And sorry?
I was going to say, do you want to briefly mention your book as well? That's going to be coming out in the future.
Thank you. So I have a memoir coming out next fall, as does Marilyn Milos, who's the founder of the movement. We started writing our memoirs around the same time, and hers is called Please Don't Cut the Baby, and mine is called This Penis Business. And that came from a conversation I had with a very old friend who was an anthropologist who asked me one day, genuinely curious, she was from Virginia, how did you get into this penis business? And I thought it was had every element of the meaning of a business. So yeah, they'll be out in the fall. Lucid House Publishing is the company that's going to be putting them out. So unfortunately, we're about a year away, but we'll be doing promotion of that. And as I threatened you, I'm going to send you a pre-publication copy so you can give me a rave review, Nathan.
If you're going to twist my arm, Georganne, fine, right. I'll read a book that's going to be awesome for educating my clients in couples. So thank you. There's one final thing that just came to mind that I'll close with. And you mentioned this penis business. I remember when I was finishing residency, before I went to fellowship at UCSD for hospice and palliative care, I got a job opportunity came into my awareness. And it was going to be an OBGYN position, but they didn't care about me doing birth and GYN surgery and all the stuff I trained to do. They were interested in circumcision. And I believe if I recall correctly, it was somewhere like Brussels or somewhere in Western Europe where I don't know why, but they needed a doctor there to do circumcisions. And they were going to pay me some ungodly amount of money per circumcision. It would have been more money than I would have ever made in the United States as a full-fledged OBGYN. I don't remember exactly where it was, but we didn't really get into the profit motivations. I don't think it's necessarily only profit motivation, but I do know that there is a heck of a you can bill for this surgery. Again, it's surgery, not a procedure, and there is money to be made. And where there's money to be made, it's going to be very, very hard to change something that has been so ingrained and normalized within the United States culture. I just wanted to throw that in there as a last something thoughtful.
Is a fee-for-service procedure. Yeah. Again, it's fascinating to me how most doctors will deny that money has anything to do with why they do it. And that might or might not be true. I'm sure in some cases I've also been told, and a colleague of mine who is an OBGYN who refuses to circumcise told me the doctors have said to him, just line them up and I'll go chop, 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 and think of all the RVUs being the billable level procedures.
Revenue, what is it?
Right.
Revenue,
relative value
units. Yeah, there you go.
Yeah, so, chop, chop, chop. Every one of those chops is, depriving a baby boy of his normal body part. Again, I think the profit motive is buried so deeply into the system that it's hard to even, it's hard to even put your hands on it. But of course, we live in a country where the medical system is the most voracious consumer of people's income, right?
Yeah.
Um,
Yeah.
and circumcision is just one other thing that's particularly grievous because it's 100% infant circumcision, 100% unnecessary and violative.
Yeah.
I just quickly, I mentioned that doctors say it's the parents who want it, and I know you have a history at Kaiser in
I
Permanente
do.
Medical Group, and I sat not too long ago, a few years ago, with a group of pediatricians at Permanente Medical Center in Sacramento, and not a single, they all, except for one who refused to circumcise, they all defended circumcision on the grounds that it was the parents who wanted it. And if Kaiser stopped doing it, it would make them uncompetitive. People, which I think is ridiculous because I don't think people choose their insurance companies based on
Talk
whether.
about putting the cart before the horse. Good
Yeah,
Lord.
right.
Yeah.
But I mean, I was shocked because these are doctors who are supposed to be thinking about, the whole idea about managed care that Kaiser was founded on was that it was, to use resources where they're most needed and to not do things that are unnecessary so that necessary things can be done. And I was shocked to find this group of relatively young pediatricians who had absolutely no orientation that way and were just defending it as being something parents wanted.
Yeah.
And, I would say things like, yeah, but what about the baby? It's like, well, I said, who's your patient? The mom or the baby?
Yeah. Well, I think I've got to start seeing clients and patients today, but I think really to wrap it up, you just brought in the rest of our principles of bioethics. We've talked about justice, which is really a reflection of the distribution of healthcare, how we advertise healthcare, how we sort it out so that everybody has equal access. We've talked about autonomy, which really is the full range of what I do. It's providing risk benefits alternatives in a non-coercive way, supporting them in their decision, accepting their capacity to make an informed decision and allowing them to live autonomously. What we haven't mentioned, the other four of the four principles are beneficence and non-maleficence.
Right.
And this is really where beneficence is, I am using my skill set, my intellect in order to provide, to boost a person's welfare. And non-maleficence is to do good.
Right.
Exactly.
Right.
Non-maleficence is related to that old adage, do no harm. And I don't think circumcision, the way it's being done, fits any of those. So we could also argue that this is a grand violation of all four of our primary principles of bioethics. And the way to stop it, guys, and this isn't on our parents for not demanding it. We have to stop saying that shit. You have to
say, I don't do that procedure. I don't do it because it's harmful to the baby.
Bingo. That's it. It's us. It's on us.
An Armenian physician from Southern California I talked to many years ago said to me, no, I tell my patients, I will not hurt your baby. I do not want to hurt your baby. I say, no, I won't do circumcisions. I don't want to hurt your baby. And Jim Varese, OBGYN, who is a friend of mine and a supporter of Intact America, who did one circumcision during his residency and wrote a Voices piece you can find on. He did one circumcision. He participated in one circumcision. He said, I have no doubt that we harmed that baby that day. Mm. And that's the do no harm, right? I have no doubt that we harmed that baby. And that baby is probably a man now, in his 20s, living without his beneficial, pleasure providing, immune protecting, penile protecting, lubricating, heavily nerve laden part of his body called the foreskin.
That's right.
And that man is living without that as a consequence of a relatively mindless action that inflicted harm on him when he was what, a day old?
Yeah.
2 days old?
Well, thank you, Georganne. This has been a very rich, as I expected, very rich conversation. We're going to link everything up, make sure people know about your advocacy work, make sure that when your book is ready, we promote the heck out of that as well. And
I'll come back on if you would like. Yeah.
yeah, we can always do a follow-up. Absolutely. I thank you so much for being so gracious with your time.
Well, I thank you for taking up this topic, Nathan. I think it's extremely important. I think your voice is super powerful, and I really feel very grateful to have been on your show.
No, it's been a real pleasure, Georganne. Thank you so much.
Have a good day.